So the next question involves minimizing the risk of multiple gestation. And the answer is yes, and it depends on what treatment you're doing. So if you're doing insemination or IUI, the simplest way is just to not take fertility drugs. If you ovulate on your own naturally, 1 egg a month, then you can do an IUI off your natural cycle, and with no medication, the risk of twins is very low, probably 1%, and more than twins, extremely rare. You can do IUI with drugs like Clomid or Letrozole, but they do increase the risk of twins to about 10%. If you have to take a drug to ovulate, but you don't want a multiple, then it's important that the doctor note how many follicles are growing, and if you have more than one large follicle, you may want to pass that month and not go ahead and try with an IUI, since with 2 or more follicles, multiple births would also be higher. Switching to IVF, the answer is even simpler. No matter how many eggs you retrieve or how much drug you take, or even how many embryos you make, you can transfer just one embryo back into the uterus, and any surplus embryos can be frozen for a later date. And by transferring a single embryo, you can really minimize the risk of multiple births. So with IVF, it's simple, transfer one embryo. With IUI, it's also fairly simple. Just be sure you have one dominant follicle available to ovulate, whether you're on a natural cycle or taking medication. Thanks.